So for situational judgment, I think I'm starting off, and then Lynn is also gonna get involved towards the end. So I'll just start off now. But good to see you're
Um,
here.
oh, Jess, should we just have literally like even just 1 minute quick eye break for everyone?
Yeah, go for it. The only thing is we have to finish by 4:30. So are people okay if we maybe keep the question time a little bit short? And I'm happy to overrun, but if anyone wants to leave at 4:30, that's okay. So we'll only have like 5, 10 minutes compulsory questions.
Guys, I've just got 1 minute on the clock. So if anyone wants to get up from their chair, have a little walk around their room, you guys are honestly smashing it in the chat. The engagement has been out of this world. Like, honestly, you guys
Give
are going
them
to do
two.
so well.
I mean,
Really.
you said one, let's give them two. I think one's a bit less. Give them another
Okay.
one.
2 minutes. If you want to go follow us on Instagram or TikTok, now's a great time to do
Yes.
that. Oh, Jess, do you want to put your handles in?
Let's put the handles in then, right? Instagram, TikTok. They're so far up. If it's probably going to be easier, yeah, if you just look for the handles rather than the links for the website. Are we on 2 minutes? Where are we at?
Guys, this is a big piece of advice when you're revising as well. Always take a break at least every half an hour, unless you're doing a mock. Get up from your chair, have a walk around, look out the window, de-screen. Don't go on your phone. I mean, we've just asked you to follow our socials, but that's just a cheeky plug. But try and like look outside, walk around, have a stretch, lie on the floor, wiggle around, run up and down the stairs. Just like de-screen yourself in your breaks because it really helps your brain to just like refresh for a moment.
So while you've all been taking your break, what I've done is I've put the link to something that should be very useful for situational judgment in the chat. And so that is GMC Good Medical Practice. And that talks all about kind of the duties and responsibilities of a doctor. And I think even it talks a little bit about the responsibilities of a medical student. And that's the kind of thing they're testing you on for your situational judgment. So how well do the answers that they're offering, the things that you're doing, how well do they fit with what are the requirements of a doctor or a medical student? So I'd really recommend you read this, not just for your UCAT, but also for your interview preparation. It's a really
Can I,
good thing to read.
can I just add to this? There's actually a medical student specific good medical practice, which is probably a better thing to read
Tomorrow's
for you
Doctors,
guys.
the second one on the list, I think, is called Tomorrow's Doctors, I believe.
Oh, sorry, have you already got it on there? I've just linked it in the chat.
Great, thank you.
Um, but yeah, sorry to interrupt. I just dropped a little link to that there.
And if you want to, there are even some extra guides. Like we've mentioned, there's one for confidentiality. There are probably a couple for other things. If you're curious about anything, especially for like your interview prep, you can always just head on the GMC website and they have guides for so many things. But like that's not something you absolutely have to know. That's just if you're interested. Yeah, okay, let's give that a go then. So, very, very key idea here. First, you read GMC Good Medical Practice, you get that done, but then you'll find that the questions on the UCAT website, some of them are not just common sense. So you think it's common sense, but sometimes it's actually really tricky to think when is it A and when is it B, or when is it C and when is it D. So what's really important is you do all the questions on the UCAT official website question bank and you get through every single one of them and you take notes on them. And it might be that some of them don't make sense initially, but you're going to memorize the answers to those questions. Because what you'll find is that there are only so many scenarios you can ask about. And we actually have an acronym that groups them together. So we'll look at that in a second. But there are a limited number of possible scenarios. And if you learn all of the different answers on the UCAT official website, it's very likely the same themes, the same ideas will repeat. So make sure you can apply the same kind of reasoning in your real exam. And I recommend do start with the UCAT official website, not with some other question bank like Medify MedEntry, because these questions are just written by medical students on the question banks. And when it's like for quantitative reasoning, that's totally okay because the numbers are always the same. But for situational judgment, because it's so subjective, you want to make sure you're learning from the right place. So learn from the question bank first. And then when you're done, when you've understood the reasoning, then you can apply it to like your what's it called? You can apply it to say some other question bank. But you have to start from GMC Good Medical Practice. And someone really useful, actually, some people have put on the chat. There's also GDC, kind of dental practice, and you want to read that as well. So good to read both, but especially if you're a dental student, you might want to read the dental practice for like dental interview purposes. So we have these type 1 questions, which are the most common, and that's all about very important, important, minor importance, not important at all. So firstly, who can tell me the difference between A and B? So A and B versus C and D. And I recommend you always start by deciding between A and B versus C and D. So what's the difference between top half or bottom half? And just to answer your question, Noshin, you read and become familiar with good medical practice. You memorize answers on the UCAT website. So they're two different things. Good medical practice, you want to read, understand, apply. The only thing you're memorizing is the answers on the UCAT website. So they're two slightly different things. You're not memorizing the GMC guidelines. Okay, so A and B versus C and D. The difference is A and B are things that are going to be important to solve the problem. So A and B, if you consider them, that's going to help. That's going to help you solve the problem. C and D, if you consider it, it's not going to help you solve the problem. So first you need to decide top half versus bottom half. For importance, will considering it help you solve the problem? Will considering it not help you solve the problem? Now, once we have to decide between them, A is like you absolutely have to consider it to solve the problem. B would be like, maybe it's good to consider to solve the problem. Now, C is going to be like, considering it doesn't help you solve the problem, but it doesn't make it worse either. So C is neutral. It doesn't help because it's already on the CD side, but it doesn't make it worse. If you consider this, it's still okay. Now, if you look at D, D is like, it's going to make things worse. So D might be something like if you had a patient in the hospital and you were talking about like one of their characteristics, so like their gender, their race, their ethnicity, that would be something that would make it worse if you consider. That would cause problems. So D is like when it's something you really can't take into account, it would make things worse. And appropriateness is exactly the same thing. So A and B are going to be ideal solutions that fix your problem, and C and D are going to be things that don't fix your problem. So C is stuff that doesn't help but doesn't make it worse. D is stuff that actively makes it worse. So the difference is importance is saying, if I consider this, would it help me to solve the problem? Whereas appropriateness is talking about, if I did this, would it solve the problem? So very similar idea. C is neutral. A and B are going to improve. And yeah, I should probably add, when I said you have to memorize, I didn't mean you literally memorize word for word the question or the answer. I just mean like memorize the idea. So, like, if we had an autonomy scenario, then it's always very important to respect the patient's autonomy. And that's the kind of thing I would memorize. I wouldn't actually memorize word for word the question, just to keep that in mind. So now we're going to take a look at some of the really important ideas for your medical ethics. But before we get started with that, I'll just talk a little bit about our strategy for these questions. So in terms of our strategy for these questions, what we're saying is that for something to be a good idea that solves a problem, it doesn't have to do absolutely everything. So we're not saying that it's the only thing we're doing. Like, for example, we're going to talk about a medical mistake. So imagine something goes wrong in the hospital and say you give the patient the wrong medication. Then the first thing you probably want to do is make sure the patient is okay, make sure that they're safe, and make sure that if there's any way you can reverse the negative effects, then you go ahead and do so. So that's the number one thing you do. What you then might want to do is let one of the senior doctors know, let the rest of the team know. You might also want to document it in the notes so other people know about it. You might also want to let the patient know and apologize to them. So, like, be transparent with them. And you also, after all of that, might want to reflect on it and try and improve so it doesn't happen again. And any of those six things would be an example of an A, very appropriate. So it doesn't have to do absolutely everything to be correct, and it doesn't have to be the first thing you do. It's just one of the very appropriate actions. And so hopefully that makes sense. It doesn't have to be everything. It has to be one of the appropriate actions. Yeah, exactly. So a reminder here to what people are saying in the chat, we read and become familiar. We don't exactly memorize word for word. But if you think about what you're learning, you're going to be learning from the UCAT website and like trying to write down key themes in your notes. And you're not going to memorize it word for word, but you're going to try and understand and review the themes. So like when I saw a question on patient autonomy, the answer was this. And it's not just about like covering the ideas, it might also be about learning literally what does the UCAT appreciate. And we're going to look at a question here, one of the last ones, that's a little bit ambiguous, but it's going to cover a really common theme for UCAT situational judgment that they always say this for this kind of scenario. So that's the kind of thing you're going to try and learn, but you're not memorizing word for word. You're just learning about common scenarios and how you approach them. And really useful information in the chat. So do read that while I'm talking. Now, we're going to talk about some key ideas of medical ethics that will be helpful for both SJT and for medical and dental school interviews. So if Lynn would like to get involved with that,
Yeah.
if you're free.
Mm-hmm. Okay, so I'm going to go over the 4 pillars of medical ethics. So these are really important to know in your STJ, as it will help you answer your questions. So autonomy. So it's the ability to give patients are able to decide their own treatment and what happens to their body. Beneficence, so to do what's in the patient's best interest. Non-maleficence, to do no harm. So for example, to choose a procedure that benefits the patient the most, but also exposes them to the least harm. Justice, weighing if something is ethical or not. Is it following the law, human rights, and is it balanced and fair? And then we're going to move on to confidentiality.
Sorry, I was just answering a question on the chat.
Oh,
Right. And
it's
just one
fine.
thing to add in terms of when you get questions like this, make sure to think about how they could relate to SJT scenarios. So, like autonomy is all about letting the patients make their own decisions. So, if you had an SJT question and it was about that the patient had access to relevant information on XYZ, that's going to be very important. That's going to be an A, because for them to show autonomy, for them to make decisions for themselves with informed consent, they have to have access to all the relevant information. So that's how you might want to link these back. And like justice might be about treating patients fairly. So if there's a scenario in which you're not treating patients fairly, that would be an example of something very inappropriate.
And here's confidentiality, and there is the GMC definition. So when answering the SEJ questions, it's important to keep in mind that confidentiality is always kept. So if there's a question where it's hinting that it might break confidentiality, then that might not be very appropriate.
Great. And does anyone have any ideas on the chat? What kind of scenario maybe you might break confidentiality? When that could be okay? And you don't need to know this, but just if you had any ideas. Yeah, exactly. So when there's a risk of harm, and in particular, a risk of serious harm. So if there's a risk of serious harm, then it may be worthwhile to break confidentiality. And in that kind of scenario, it might be a good idea to first discuss this with kind of a more senior member of your team. So you wouldn't just go ahead and make a decision like that. If you were a junior doctor, you'd maybe speak with some other people, get some advice. But the key idea is when there's a serious risk of harm. And there's also kind of some very specific examples that are written in law when you're allowed to make disclosures. So, for example, there's a case with like the DVLA, the Driver Vehicle Licensing Authority. And if someone is not safe to drive and they go ahead and drive anyway, that would be an example of when you're allowed to disclose by law. And that would be obviously because there's a risk of serious harm to people around. And you might also be able to kind of do this in cases of certain diseases. So, like tuberculosis, some very like risky infectious diseases, you're allowed to disclose in those kind of scenarios. So, the key idea is like, does the serious risk of harm outweigh the damage to the trust in patient trust that's going to happen from breaking confidentiality? Now, the HIV question is like very a little bit more complicated. HIV is actually not one of the compulsory disclosure diseases. So if someone has HIV, you don't just go and disclose. But if they tell you they have HIV and they are going and doing risky behaviors, so like the thing you said in your scenario, where he's kind of still going ahead with risky behaviors despite having HIV, in that case, it would then become serious risk of harm and it would then be in the public interest. So, yeah, that would be an example of maybe when you do break confidentiality. So, now think about who's who.
Yeah, so there's different roles with students, junior doctors, and senior doctors. So for the SCJ, we look at the roles which, for example, medical students can and can't do. So there's a list here of, we shouldn't deliver results to patients, but more senior doctors can, and junior doctors can. So for answering the SCJ, we look at these and we see, is it within our competence to do this? So for example, there may be a scenario where a student is being told to do something that isn't within they haven't learned or isn't within their competency. So let's do quite a risky procedure, for example. It would not be appropriate for them to do that because they've not been fully trained. Is there anything else to add?
Yeah, I think that's everything. So, like, medical students pretty much can't do any kind of medical stuff. They can't interpret scans. They can't give well, they can help to interpret, but they can't do it on their own. They can't give medical advice. They can't prescribe medications. They can't give results. The only thing they can really do is like minor procedures and stuff when they're being supervised by doctors to learn. And even then, they have to ask permission from the patient first. And so, what we're going to deal with in a couple minutes is potentially a scenario which is all about a student in the hospital and what they can and can't do. And in any case, they're only allowed to do a very limited number of small procedures or to assist, and that's when they're being supervised. So stuff like taking blood's gonna be okay. Stuff like going on your own and doing some kind of surgery, obviously not gonna be okay.
So informed consent. So there are things that should be done when a patient lacks capacity. So there's a scenario at the top where a small child is resisting some form of necessary treatment. So then referring to the points below this, does the child have the ability to give informed consent? So point 2, are they able to understand all this information? Probably not. So then this then goes to the parent for them to make the decision for the child. And the general rule of thumb for mental capacity is, are they able to understand the information given to them, weigh up the information, so the pros and cons, are they able to retain it and then communicate it back to you? So when approaching questions, such as questions that mention that the patient has access to relevant information XYZ, so do they have access to this? It's always very important, and it's always normally a very important thing that they have all the relevant information and that they are informed.
Really, really good. Only thing I would maybe add is just this top one at the like we have here. So a patient who lacks capacity. Now, imagine we have a child. This child does not have capacity. So like you looked at the thresholds, they can't understand way retain communicate, and they're saying no to the treatment. So this is like a 5-year-old child. They're wriggling around. They don't want the treatment. The parents have consented. Do you go ahead and force it on them? Is that the best thing to do? Would that be an A? So put in the chat. What do you think? You go ahead and do it anyway. So some people are saying yes. Is that what you think a good doctor would do? Just grab the child and do the procedure? No. So what you want to do instead is to try and reassure the child, try and calm them down. Maybe be like, oh, your mom can hold your hand. Let's get you a sweet. Would you like to maybe have a minute and then we do it? or like anything that's going to reassure them, maybe try and distract them a bit. But you're not just going to force it on them. First, like get the parents to calm the child down. Maybe you try and calm the child down as well. Try and communicate. So you don't just force treatment on someone who lacks capacity. You still try to show as much empathy as possible. But yeah, you're not going to expect a 5-year-old child to understand, weigh, retain, communicate. That's not hard. So some general pointers.
Yeah, so patient safety is always very important, always number one. Dishonesty is always very inappropriate. All mistakes should be reflected upon. And any cover-up would be very inappropriate. And it's better to raise an issue with an individual before escalating. So it's always important to tell them that you're gonna do something before just going straight to a superior.
Nice and local solutions. If someone has done something wrong, try and bring it up with them rather than going 10 levels up to the dean of the university and saying that, oh, this person has done so and so. Local solutions, not raising too high. So, what might this be all about? Any ideas? Animal testing. UCAT is not for veterinary, so I don't think so. Cheap hamster, very good. So cheap pet is what we're looking for. Now, what might cheap pet be all about? It's an acronym that stands for the different kind of scenarios you can get. Confidentiality, honesty, empathy, autonomy, professionalism, patient safety, equality, teamwork. They usually fit into some of these categories, maybe multiple of them. When you make your notes based on the UCAT website, I recommend you have like 7 headings. Is that 7? 5? No, 8. 8 headings, and you class your notes under these 8 headings. So when you see something about confidentiality, you put your notes under confidentiality. Then when you go back to your exam in the real thing, you're going to think back. The last time I saw a confidentiality scenario on the UCAT website, what was the answer? When I read Good Medical Practice about confidentiality, what did I learn? And you're applying the same kind of logic that you see on the UCAT website. So remember, you first decide appropriate versus inappropriate. Does it solve the problem? Does it not solve the problem? Then you decide, does it make it worse? Is it neutral? Like C versus D. Now, in terms of the language, that's really important. So if we have one that talks about like propose, encourage, explore, support, recommend, ask, inquire, that's probably going to be a good one. That's probably going to be an A. But if we have ones like threaten, blame, refuse, avoid, that's probably not going to be an A. And if something would otherwise be a really good solution, but instead of encouraging or explaining to the patient, you tell them, what that sounds like is you're not really working in partnership with them. You're not really discussing with them. You're just telling them something. So that might immediately move something down from an A to a B because it's not quite the best thing to do. The best thing to do would be to work with them, to explain it to them. So mitigating factor is just something that might make something like not as bad. That's what a mitigating factor would be. And this is the cheap pet. So if you need the acronym. And then Lynn, I can't remember. Was I the first question or were you the first question? I know we talked about a few. I was the first one. Okay.
Yes.
We probably don't have time for loads. We can do a couple. So start off. Who is the key individual? What kind of scenario is this all about? Making her own decisions. Very good. Autonomy, and we have a GP, so a fully qualified doctor, not a medical student. And what did we say about autonomy? What is it always? Very important. So this is an A, exactly. Her right to make her own decisions, very important. Good. Right. Lynn, do you want to do the next one?
Yep. So who is the person in the scenario? So Gary is a medical student. And if we look at the question, tell Rachel that it's important that she attends her blood test appointments. So it's obviously a helping situation, so it'd be in the AB type side, but because the phrasing says tell and not ask, it would be B.
And let's take it. Everyone happy with that? Let's go for the next one. Yeah, people in the chat seem good. So next one, same idea. We've got same scenario, but we have now asking Rachel. So is it going to solve the problem? Yeah. So we're going to find out why is she not coming and try and deal with the patient safety issue here. Now, the patient safety issue is that she's not coming to appointments that she needs to come to. So by asking her what the problem is and trying to fix it, you are dealing with the patient safety issue. It's on the A-B side. Now, is there anything wrong with it? What do we think? A or B? Yeah, A, I can't see anything wrong with that. You're just asking her what we can do to help. So let's try maybe the next one now.
So ask a senior colleague to explain to Rachel the importance of having the blood tests. So
We let them have a go?
nothing wrong with this. So yeah, the answer would be A. Very appropriate.
Very appropriate. Okay. Next one. Now let's let them have a go for this one. Yeah, all good. Everyone's an A. Yeah, great. So ask her if she understands. That's going to help you solve the problem. Can the med student not say it himself? So in this scenario, the med student is saying it himself. In the previous scenario, the med student has asked a doctor. Now, if it was a doctor asking another doctor to do an issue for him, that's kind of pushing off a problem. So that might not be such a good idea. But if it's a med student and they're asking for help from a doctor in the hospital, that's always a good idea. So med students asking for help is never a bad idea. That's always going to be a good thing. If you're not sure, that's what they want you to do. Go and get some help. So these are quite similar. What about this one? And then Lynn, do you want to explain when you see the answers in the chat?
Yeah. So D is because it's not going to help the situation at all. In fact, it's definitely going to do more harm than it's going to do good. So it's definitely D.
Yeah, it's definitely D, because if she's not going to come to the appointments and you're telling her not to come, then that's going to make the patient safety thing worse. So that's definitely a D. And in terms of what people asked about junior doctors asking for help, that's also totally okay. So as long as you need help and you ask for it, that's the best thing to do. What you can't do is a procedure you don't feel qualified to do. That's going to cause risk to patient safety. And you see the same theme coming over and over again. Anything that causes risk to patients, you're not going to do. So if you're a doctor, you ask for help, that's okay. The only thing that's maybe not a good idea is if you're like pushing off an issue onto someone else. So those are two different things. If you're getting someone to help you, that's fine. If someone has given you a task and you are capable of doing it, and you give the task to someone else who is just as senior as you, who doesn't know anything else, and you're just doing it because you're lazy, that's not acceptable. But if you actually don't know something and you're getting help from someone, or you're really busy and you've got too many tasks and you're getting help from someone, that's the best thing to do. So always keep patient safety in mind. If you don't feel confident, and so someone had something really good, always work within your level of competence. So whether you're a junior doctor or you're a med student or whatever, if you don't know, you should definitely ask. Now, Anne, you raise a really good point. Could it come across as patronizing? So what you have to assume is that any of these sentences are said in the most polite way possible. So whatever the scenario is, you're going to assume it's said politely. Right, and let's do maybe one last one. Do you want to talk about this one?
Yes. So does anybody know the answer?
Okay, someone says, isn't he giving medical advice by telling her to attend the appointments? Okay, so you do have to use a little bit of like common sense, maybe. So you can't give medical advice as a medical student, but telling someone that they should probably go to their medical appointments is not necessarily specialist medical advice. Kind of if you as a layperson saw your friend not going to their medical appointments, even you would give that advice. So telling someone to attend the appointments is not really medical advice. That's more like advice as a like general good Samaritan. If he was giving more specific advice about like what to do in the appointments or like what procedures they should have, that wouldn't be appropriate.
Okay. And going back onto the question, so this question is a
Sorry.
little bit tricky, no worries. It's a little bit tricky. So the answer is C. So the GMCC's learning experiences is really important, but obviously as a medical student, you are not within your bounds to give birth to help deliver a child. So it would be C, but if yeah, it would be C.
Yeah. So I thought this was actually a bit of a weird one. And this is why I say it's really important for you to go on the UCAT website and kind of start to learn the answers. Now, I mean, any of the doctors here, what do you think? Megan, would you agree? That's a bit strange for
What's
this
the
to be a
question,
C?
sorry?
I think
Look at this
it's got a
question
weird.
here. Like, I personally would think that this is a little bit strange to call it a C rather than a D. If Mia's
Wait,
not
Frank, what do
comfortable
you
to deliver the baby, the learning experience isn't really that important.
Yeah, I mean, learning is probably not the important thing. I think the idea is that whether you feel like you can, I don't know. I guess if you
Oh,
feel like you can help, and in those acute situations, we don't get any training on how to deliver a baby, so I wouldn't necessarily rely on that. But it's not a cardiac arrest or something that you get training on all through medical school. In the idea that it might just happen to you, so that's what I would say. So I think the
also,
key thing is that she doesn't feel comfortable delivering the baby rather than like, and therefore her learning is never should never really be coming into any like consideration.
yeah, that's the distractor, the learning bit. It's kind of saying like just because it would be a good opportunity, should you potentially compromise? You
Yeah,
can actually in real life, if this was an interview, you could say, I could support from a role of a non-medical professional, for example, helping carry equipment, helping with practical support, but I am not qualified to support in a
yeah.
medical setting or act as a doctor because you're not. And there'll be distractions like this, guys. And it's really important to say, like, actually, patient safety always comes first, and you should never, ever, ever do something you don't feel comfortable doing.
Sorry, just to say, we all completely agree as a panel, we've all agreed that this really should be a D. Patient safety should come first. Now, for the purposes of the UCAT, this is why I'm saying specifically learn answers on the UCAT website. Because for the purposes of the UCAT, and there's no real reason why this should be the case. Like all the doctors here have agreed that really learning experiences are not what you should be thinking about. They always say that learning experience is a C. Even though at interview, you would not say that that's the main consideration. The main consideration is that she's not competent. But for the purposes of UCAT SJT questions, whenever you see the words learning experience, and I've seen another question exactly like this on the UCAT official website, and it's about a dental student, and they don't feel confident doing a certain procedure. It still was a C. So it's not really something that you can justify, I would say. It's more something that you're just going to have to learn and memorize. When you see the words learning experience, even if you think it's a D, it's probably moved up to a C, just as a general rule, which I think is a bit strange, but worth just memorizing something like that. So, Safwan, you've said, would it be C because it's not completely negative and there's at least one positive? Yeah, exactly. So that's kind of the reason why. But again, like this is probably one that I would say is a bit ambiguous, but I've seen this a few times on the UCAT website, so just memorize it. When you see the words learning experience, you make it a C. If it was something like that, she would enjoy the experience, then you're going to make it a D. And even though, like most doctors would probably say that really doesn't matter whether or not she'll learn, you're going to call it a C anyway. And just in terms of how these are marked, I'll probably put that out there. If it was 4 marks for a C, then B and D would get 3 marks and A would get 2 marks. That's how it's marked. So if you had D instead of C, you'd still get 3 out of 4 marks. It wouldn't be a massive difference. So this is only a small thing. It doesn't make a huge difference. Now, let's maybe go on to the Q&A. Oh no, Lynn about reapplying.
Oh, Jess, could I just ask a question? Are all of the questions as a medical student as opposed to as a junior doctor?
No, a bit of
some are as a
everything.
junior
There's some
doctor.
as a work experience student. There's some as a medical student. There's some as a high schooler. Some as a med student. Some as a dent student. Some as a doctor. Some as a dentist. There's a whole spectrum.
Okay, thank you. Still is the same though, guys, as an F1. For example, like a central line or a lumbar puncture, if one was needed overnight, even if it was really, really, really important, I would never ever do one because you can cause so much more harm by giving it a go, even if you're not sure. So never, never do that.
So two things we've got. One is real life. Real life, no way you would touch a central line, as the doctor has said, if you're not qualified to do it. But if it's a UCAT question and it says the word learning opportunities, you're going to give it a C anyway. That's what you have to remember. Because the idea is
Listen to
not
the
to
boss.
become a good doctor, unfortunately. The idea for this particular subtest is just to get the questions right. But in interview, you're not going to say that. In interview, you're going to reason your way through it. So Lynn, sorry to interrupt. Go for your talk.
Yeah, so hi, my name is Lynn. I am a reapplicant. So I got into medical school during my second application cycle. And I'm here to tell you a bit about my experience, reapplying, and also some final UCAT tips. So first of all, I want to highlight not to give up. I know the UCAT's really hard, and there are different parts of the application process that will knock you down. So for example, the first time I done my UCAT, it did not go well. And I got what was considered a low score, but through some strategic application, I still managed to get an interview. And this shows that even if part of your application doesn't go to plan, you still have a chance. And even though I didn't get a place at that university, I decided to take a gap year and reapply. So what did I do during my gap year? So I got the opportunity to solely focus on my UCAT. I didn't have to juggle it with school, and I had the time to find the best way for me to study and ended up getting a much better score. I gained a lot more life experiences and skills by working in tutoring. I also used my time to interview doctors, gain more clinical experience, and read lots of medical books and journals, which strengthened not only my personal statement, but also my interview answers, sorry. So lots of people ask me, will I be put at a disadvantage if I reapply? And for that, I say, no, you won't. In fact, for me, it became an advantage. I got to highlight to the medical students my perseverance and passion for medicine. I also got to show key skills such as reflection. It became the core of my second application, basically telling the admissions boards that I am fully committed to a career in medicine and that I am not going to give up. So to conclude the very short talk, the UCAT is a very big hurdle to get over, but definitely don't give up. If you know medicine's for you, don't give up. And I have some final general UCAT tips for you guys. So book your test time for a time where your brain is more active. So if you're a morning or an afternoon person, and do practice at the time of your booked UCAT slot, just to get used to doing such mind-numbing things at that time, so your body gets used to it. And if you don't feel prepared, always know that you can move your date. As long as you do it 3 days in advance and before the end of the examination cycle. I would recommend doing mocks in a different environment. So I done my mocks at the library. So getting used to kind of having some background noise and some slight disruptions will mimic the test environment. If possible, borrow or buy a keyboard, a computer keyboard, as to get used to quantitative reasoning, the keypad, and also the shortcuts with the keyboard. I borrowed my brother's gaming keyboard, which he did not like, but answer all the questions, and even if it is a guess, so try and answer all the questions because you will not get marked down if you get the questions wrong, but you might just get a question right. Remember to take breaks during revision and don't let yourself burn out. Mindset is very important during your UCAT. So try not to stress too much, which I know like everybody will say don't stress and you're still stressing. But when I first done my UCAT, I treated it as like the end be all end all. Like it was like the just everything, and it overwhelmed me, and that's why I scored quite low. So have confidence and I believe you guys will smash this. Sleep well the night before. Well, try to sleep well and eat a nutritious breakfast or lunch before your test. When entering the room, don't rush to start the exam. The examiners might try and rush you, but just get familiar with the keyboard, the mouse, put on your headphones or earplugs if you wish, take some deep breaths and try calm any nerves that you may have. And if you wish, in between sections, you may jot down some things such as acronyms for the next section. But do remember to give your eyes and brain a rest between each section. And that is everything I have. Does anybody
People on
else?
the chat are saying you did a great job, so very well done. Just like put that out there. So look at all the nice comments you're getting on the chat.
Thank you.
And I think Abdul Rahman meant goated rather than coated.
Guys, I just wanted to also second
Goated, yeah.
when I literally, this will be a 2-minute thing. Otis, I know we're quite short of time, but I just wanted to also say I missed my grades for medicine. I got ABB. I wasn't even close. I was devastated. I had an offer from my first choice med school, which was Leeds. Did reapplied to medicine. Medics&Me would never have existed if it wasn't for me not getting in that first time. And in my first year of a doctor, the only reason I tell you this is because I think I got average 640, average 630 maybe the first time I did the UCAT, and I got ABB. I got 690 the second time. I think I went from like 620 to 690, but then I did the BMAT and got in an interview at Leeds. So I got 620, let's say my first UCAT, ABB. Then I got into medicine, applying strategically, going again. And then this year I won Junior Doctor of the Year and Portfolio of the Year from my trust. And one from each different trust that I've worked in. But the reason I think I won those awards is literally because of those reflective skills I learned from the setbacks of what happened to me when I was 18, 19, 20. I think having those experiences taught me, just like Lynn, so much about myself. So if you don't get in, guys, I promise you, if you still want to do medicine, big things are coming for you, because the resilience it takes, as Lynn said, to turn it around and get back on the horse, actually, like, it teaches you that much that you come back bigger, better, stronger, and you guys have got it. So hope that helps. Anyway, over to the Q&A. Lynn, thank you so much for all your tips. Such a good piece of advice about I've never even thought of that, doing your mock in a separate place. Amazing. Love that.